why are you running all these crazy complex systems? And it's like, well, the client can't fire me because they have to have me. Nobody else knows how to work this stuff.
Exactly.
You're listening to the Help Me with HIPAA podcast, where HIPAA and humor collide to make learning fun. Your delightful hosts are Donna Grindle and David Sims. Relax, HIPAA help is on the way.
Welcome to episode 419 of the Help Me with HIPAA podcast. My name is David Sims of HIPAA for MSPs, and joining me is Donna Grindle of Carden. Good afternoon, Donna.
Good afternoon, David.
So what's been going on with you? Anything new lately?
I had a friend come visit this weekend, so there was between the partying and sitting up late, talking and catching up. Just hadn't really seen him in a while, talked to him in a while. So I'm a little ready for a nap.
All right. Well, this shouldn't be too bad. We're going to be talking about your favorite subject today.
Mm-hmm.
Data points.
You know, I love data.
Yeah. So we do this kind of, at least every year. Sometimes we take a couple different studies and look at them, but today we're going to be looking at the 2023 cost of a data breach study done by IBM. And this is where we look at not just the cost of it, but what can we do to reduce that cost? What are things that we can do to increase that cost? Not that we want to do that. And, where do we fall in as far as healthcare and all these other businesses, and where's the risk and what does it look like from other people who have gone down paths that we hope we never go down, which is being part of a data breach. And so it's one of those things where you do want to know, like, what can I do to improve my chances? And we talk about that today.
To improve your chances of having a data breach?
To improve your chances of surviving a data breach. But yes, we could also talk about what you could do to improve your chances of having one. Just do the opposite.
Well, you wouldn't be listening to this if that's what you were doing. So there you go.
Yeah, it's I can't remember the exact term for it, but it's kind of one of those things where you go with the worst case scenario, and you're like, how can I completely destroy my business? And you list all those things out, and then you go, okay, if I just don't do these, and there's a term for it. I can't remember what it is, but that's basically what you could do in this scenario. You could say, all right, how many things could I do that would guarantee me to have a data breach and a terrible outcome from a data breach? And you just don't do those things.
That's kind of what we're trying to get at, though, is the big reason that we review this every year, and they've had, 13 years they've been doing it, and we've been doing this. This is our 9th year. So we've been looking into this because I don't like saying this is just my opinion, because we know about opinions. I like to be able to back up my opinion with data. Like information, actual receipts of information. I need to know, anybody can do a survey and do these reports, but we know Ponemon and their process and what they go through, and, IBM and how they generally are quite conservative with things, and Ponemon is very detailed with things. And between the two, I feel like it's data I can trust, because you can't just say, well, I have data, I'm going to go with it. Not in this day and age with the deep fakes and everything.
I heard somebody say this was a thing.
I know, right?
Yeah. To that point, if you're talking to, whether it's a prospect you're trying to sell into, or whether you're talking to the C-suite and you're trying to get them to understand these are the things that we should be doing, whether it's in a compliance program, privacy and security program, or just, hey, we just want to do what we can do to reduce the cost of a data breach. This is information that will help you with that.
So that is how we make risk management decisions, is let's do more of the good things and less of the bad things.
Sounds so simple when you put it like that.
Uh-huh. It's just like, what is the good thing and the bad thing? That's the hard part. And we
Yeah.
use these things to help us.
And then, of course, when you talk to me, it's more like, define bad.
Let's think about this for just a minute.
That's usually, there's almost never a report that doesn't come out where I'm like, well, define that word. What exactly do they mean by that?
Let's be clear, because of course we had to go through that in this.
Because I'm always asking those questions.
Yeah.
All right. Well, before we dive into that, I do want to say thanks to our donors. We appreciate your support. And if you would like to be one of those who help us stay on the air, as they say, you can go to helpmewithhippa.com to find out more. But you can always leave us a review, whether it's on Facebook or wherever you listen to this amazing podcast, and we would appreciate it. So thanks a lot.
I concur.
All right. So let's get to our newest segment, HIPAA Briefs. Let's answer the question that you're all asking. Does HIPAA apply to all healthcare records? What say ye, Donna?
I say nay, nay. Nay, nay. That is not true.
Yeah, this is one of those questions where everybody answers, well, of course it does. And you're like, no, it doesn't. Like, what?
Mm-hmm. Yeah, I always like the questions. If anything that you could come up with, somebody's going to be very confident in the wrong answer with a lot of these things. And
that is true.
Now, the HIPAA may apply to all, but not HIPAA that we talk about. And for the most part, I bring this up because we'll cover in HIPAA Say What, where a study said 81% of Americans assume that all protected health data collected by digital health apps is protected under HIPAA. So that statement alone bothered me because you don't have to say that all protected because it's not protected.
Right. Yeah,
it really should read, assume that all health data is protected under HIPAA. It is not. Mm-hmm. So they have an extra protected in there that really needs to come out of there. I'd like to extract that.
Mm-hmm. Yeah, I mean, even as you were saying it, I was like looking at you sideways, like, wait a minute, what? How can it be protected health data that's not protected? Because it wouldn't that make it.
I know. Okay. So, well, first of all, that drags me in, right?
Yeah.
81%, and then protected. No.
Yeah.
So there you go.
Double protected.
But the bottom line is these health apps are everywhere.
Yeah.
And there's all these tools that track and keep up with how many steps and how much water and I mean just so many things that the technology is there. But unless it is technology that you are getting paid for by insurance is involved in a payment somewhere,
Mm-hmm.
No. If it's something you can download or you can buy on your own without going through any of that, it is not protected health information.
All right. So, well, we'll segue right into the HIPAA Say What because we've already jumped into it.
Yeah. But look, we want the HIPAA brief to say, here it is. Does HIPAA apply to all healthcare records? The answer is no. It does not. It only applies when you fall under HIPAA as a covered entity or the work you do makes you a business associate of a covered entity or another business associate. And that's not all cases. So there you go.
Yep.
No.
That's the short answer.
Well, it is a brief. It's supposed to be brief.
All right, HIPAA Say What? So we talked about the Clear Data. They did commission the Harris poll to conduct a survey among 2,000 U.S. adults aged 18 and older, which I'm glad it's that because I hate the ones that are like, we surveyed 100 people. And I'm like,
nah,
that's not really a lot of people. But yeah, so 2,000. It always reminds me of the game show, though. We surveyed 100 U.S. adults. And
what's the number one answer?
Yeah. So you're right. They looked at it and they found that as many as 81% of Americans assume that health data that's collected by digital health apps is protected under HIPAA. Honestly, I was shocked that it was as low as 81%. when you got people out there saying, you can't ask me about my mask wearing because that's a HIPAA violation.
Oh, jeez. That was a brutal time.
Yeah, and they
It's
think that
still happening though.
Yeah, and people think that anybody who asks them anything about their health or health care is violating their HIPAA rights, and they don't understand it at all. So
they tell us we're wrong. That's always the fun one.
Yeah, they argue with you.
You're wrong. You're wrong. My favorite one was the guy that said that everybody who was saying that is wrong, that his wife was a paralegal back in 1990 when they drafted or in the 2000s when they drafted the law. And I'm like, they drafted the law in the 90s, and a paralegal is not going to understand what the law says today.
No.
Unless they've stayed up with it.
Yeah.
But that's what made him an expert.
Yeah. This is as bad as the person who's, I've been in healthcare for 12 years. I understand HIPAA fully. And then when you ask about what kind of training they've had, it's, the once a year, 30-minute video.
Yeah. Because that's what so many people think. That is all there is to it.
Yeah. Not only do you not have 12 years worth of understanding of HIPAA, but you really have 1 year understood 12 times.
You have what we call the workforce training.
Yes.
You do not have the actually implement and manage training. No. So It is interesting that many people falsely believe that to be the case. And then it was like only a third, and this is where we got our chuckle of the same old. Security is always too much and inconvenient until it's not enough and it let me get hit.
Mm-hmm.
So a third of the people say that's one of their top 3 reasons they, what they look into about choosing a provider. Unfortunately, they don't even, the number one thing is what really everybody has to deal with. Is my insurance accepted?
Yeah.
That's how you get to decide. So, you don't really get to pick your own provider. You get to pick your provider within who your insurance tells you can.
Mm-hmm.
But that is not important in every case. And really, if your insurance pays for it, but your data was still stolen, your insurance could be paying for somebody else's care.
Yeah. Yep. No, nobody cares about it until it's too late, and then they care about it. And the other thing too is, how do you gauge that? Like, if I wanted to go to a provider and say, I'm considering making you my primary care provider, how do you handle my data? That would be funny. Like, I would literally like to see that recorded as to what happens next.
It's fun for me when I go to providers now, and they're like, they've at least kind of backed off on the Social Security number thing. They don't have to have a Social Security number anymore. So, because I'm like, I'm not giving it to you. I quit doing that years ago, and now I've quit giving them copies of my driver's license. It's got too much data on it, with the QR code and what all that attaches to on the back of it, and you can go in and use those copies and then really just make a new one that looks exactly like that. Mm-hmm. So, no, they say, we want a copy. I'd just like to make a copy of your driver's license. I will show it to you, but you cannot make a copy of it. And they're like, You're
so combative, Donna. You're so combative.
Yeah, they're just like, wait a minute, that's weird. No one ever says that. I was like, look, I do this for a living. I don't want it any more databases, please.
Sorry. I just watched Enemy of the State this weekend. You know?
That movie tortures Carla to this day. If you haven't seen it, you should go see it. So, anyway, the thing that we should all know is everything isn't covered under HIPAA. So, and we struggle to protect all the data that is. And if you think that all of these app providers, they can sell your data, they can do whatever they want to with it. They really can. They can be selling your data with your private details, down to how many steps you took and where you went, to anybody they want.
Chances are their terms of service probably says so. I mean, you didn't read it.
Everybody just click right on through.
I always want to do one of those terms of service, like we're going to take all your information and sell it, and people will still click on it. Okay, that's cool.
I remember reaching out to somebody and I said, according to your terms of service, if you steal my data, I have like no recourse. You are not responsible for anything you do with my data, is what it said. I'm like, I'm not putting healthcare data in here, but I still ain't giving you all of that. You have zero responsibility to protect and care for my information, and zero things I could do if you fail to hold up your end of the business relationship, because you really don't have anything to hold up.
Yep.
So yeah, you got to read these things.
Yeah. And they're probably like, okay, Donna, but you're just the one person that realizes
We're not changing this.
Yeah, we don't care. The other 99.9% would still give it to us.
Yeah, I have cut off multiple people because of those things. Nope, when I'm not doing that.
All right, so let's look at the global average total cost of a data breach in this 2023 cost of a data breach survey, because it is a big number.
How much is that, David?
That's almost as much as I carry in my pocket. $4.45 million.
Wow.
Is the average cost, not the high cost, the average cost of a data breach.
And everybody's like, well, that's just ridiculous. That's just for big companies. Fine. What, like, that's the average. Then the low is still like $1 million. I don't know about you, but if it costs $25,000, I'd still have a problem with it.
I know. Like, what? $25? I ain't got that.
I could handle 445, maybe.
Yeah.
But you get up to 45,500, I'm out.
Yeah. Yep. And this is where we talk about this all the time, and I'll bring it up every time. But for those who have their response plan is, I'm going to call my insurance company and they'll cover everything, you're going to be in for a rude awakening.
I'm telling you. It's a very rude awakening when you see what they will pay and what they require.
Yeah. Well, we did find out too that the healthcare industry, as often they do, they did score number one.
For the 13th year in a row.
I mean, don't you get a trophy for that?
Nobody would take it. Everybody be like, no, you go ahead. I don't want that one.
Yeah. So, 13th year in a row, the healthcare industry wins as the most expensive in data breaches at an average cost of $10.93 million.
Yes.
Congratulations.
And that is a 53.3% increase just since 2020.
Wow. It's almost as much as my gas prices went up.
53.3. I could never do math like that quickly because I got to focus. So we have the 4.45 million is all data breaches worldwide that they study, right? And they have systems they use about what groups they study and all this kind of stuff. So 13 years, and they've been doing this 18 years. And So the first 5 years, I'm going to wager, if you go back, let's see, how long's HIPAA been around? 20 years. I'm not saying, I'm just saying. We're just now seeing healthcare as soon as healthcare really became connected and started having that capability of data breaches. Boom. Boom. And then we progress, David.
Yeah, we do. So then next we're going to look at the percentages of breaches that involve data stored in the cloud. But, Donna, if you move it to the cloud, it's safer.
It can be.
Yeah. Well, this goes back to what we talk about all the time about doing your risk assessment and knowing where your data is and how is it protected? How is it configured? I can't tell you how many times I've seen somebody take data that is configured very well on a local server and then move it to the cloud where it is not configured properly at all.
Or it wasn't configured very well on the local server and they moved it to the cloud and didn't make any difference because they didn't worry about the security before and they're not worrying about security now. You have to actually worry about the security for it to be good security.
Mm-hmm.
And when it says highly recommended, you should do that.
Yeah. The other piece of that too is when you start talking about cloud, and this is the next thing that we're hitting, is that once you start getting into complexity, it becomes a big problem. It becomes a huge problem. As a matter of fact, I think it's the number one huge problem is the complexity of your security and the systems that you have, because it becomes harder to protect. And in some cases, I don't know that they do it much today, but I know years ago, I used to argue and fuss all the time about IT companies that needlessly put complexity in place to keep themselves relevant. And it's like, it never fails. Like, why are you running all these crazy complex systems? And it's like, well, the client can't fire me because they have to have me. Nobody else knows how to work this stuff.
Exactly. Yeah. Or that some salespeople have made them believe that these are all the magic tools, the magic sauce that, you're not going to have to worry about any problems because we're going to catch them all. It's just like that, the XR and the remediation, where, we're going to automatically remediate it. And, I think it was Gary mentioned when he was on with you about how, they outsmart those tools too.
Mm-hmm.
It's no guarantee.
So when we look at the cost of having complexity, it looks like, according to the study, that you're going to be looking at a data breach increase cost of about 31.6% higher because of that. Yeah.
So
as if it wasn't bad enough.
1.44 mil.
Yep. Yeah. So, as we mentioned in the beginning, if you want to know something not to do, it would be not to have complex security systems in place.
Exactly. Somebody needs to understand what's going on in order for you to be protected.
Mm-hmm.
And the one thing that really has not changed.
Yeah. It hasn't changed in good ways and bad ways.
Yes.
So the cost savings achieved by organizations with high levels of incident response planning and testing. So we preach incident response planning and testing all the time. What would the cost savings be, Donna, should an organization decide to follow our recommendation?
The organizations with high levels of incident response planning and testing saved $1.49 million compared to those with low levels.
Wow. So if you did have complex security systems and you also had high levels of incident response planning, you would still come out better. It almost equals it out. Um, but yeah, so the incident response planning, I like that they said and testing because, you can plan all day long, but you don't really know if that plan's going to work until you test it.
Well, and planning is better than not planning. So
Mm-hmm.
you start with no plan, then you make a plan. It's still better to have a plan you haven't tested than to have no plan.
Mm-hmm.
But then if you test it, even just sitting down and doing a desktop exercise, it's seriously, as it says here, being a priority investment for organizations. That is it. It's the high levels of planning and testing, in addition to being a priority investment for organizations. It is emerged as a highly effective tactic for containing the cost of a data breach. And we know that.
Mm-hmm.
We know it. You
Yeah.
can't always convince people of it, but we know it.
Yep. So the total cost of data breach has been increasing every year. We did see a small dip, though, in 2020. I don't know of any reason why anything was going crazy in 2020, but we did see a small dip. But in 2021, it jumped up with some ferocious increase, and it's been on the rise ever since.
Yeah.
So we don't anticipate that to go down. And not just the total cost of a data breach, but even when you look at the per record cost, it did the same thing. Like the per record cost dropped a little bit from 2019 to 2020, and then it just, skyrocketed
Exploded.
back up.
Right. Just exploded.
Yeah.
When you look 2017, so that's, one of the early years where we would have been checking it. And I remember it being in the 140s. And then it was getting up to 150. Then it dropped to 146. And that was 2020. And then today it's 165.
Yeah. So this is the fun math project for you to do when you want to think about how much would a data breach possibly cost me. You just simply take how many records you have, multiply it by $165, and there you go.
Yeah, and a lot of people are like, well, that number is way out. Okay, fine. Use 141.
Yeah, the lowest it was back in 2017 at 141. So try that number. You still won't like the results you get.
Yeah, pick that number. Pick the number, go with the short, the smallest number in the report. You're still not going to be happy.
Yeah. And then, we do know that we can look at the cost of a data breach by industry. And we do this every year as well, because we want to know, where does healthcare lie? And we've already said that we're number one. We're number one.
By a lot.
It's almost twice as much as the number 2 position.
Right. So everybody expects financials to, that's big. But you know what? They lock down financial data. All of the things, but it's a much more narrow list of data contained in very specific areas, generally in a manner where the people that have the money are the ones locking it down, and the people in healthcare, it's like all over the place. Data's everywhere.
Yeah.
Healthcare is just spewing data.
That it does. Yeah.
So it was, 2022, the average cost of a healthcare data breach was $10.10 million. It's now in 2023, $10.93 million. It's almost jumped $1 million. That's crazy.
Yeah.
But then you get down to the next one, David.
Oh,
next
gosh.
one down.
Yeah.
5.97, and it dropped to 5.9.
Yeah.
It's like half. So when we look at that $4 million number, it's healthcare that's driving that number up. So anybody that says, well, healthcare breaches won't be, healthcare is the reason the average is so high.
Yeah.
If you take it, I wonder if you took healthcare out, the average would probably be somewhere, I don't know, 3. ish.
Yeah.
Yeah, just looking at the
Yeah.
numbers.
So the number 2 position was financial. It went down compared to last year. Pharmaceuticals number 3 position went down compared to last year. Energy's number 4. It went up slightly. And then rounding out the top 5 is industrial. Well, I'm going to add number 6 because it's technology.
Right.
But technology actually went down too.
Yeah.
And so it's interesting. The ones that went down slightly, but the ones that went up, I think, yes, yeah, I mean, you can definitely look at it and say healthcare went up higher than all the rest of them.
Yeah.
The only other one
Yeah.
that was even close to having a decent jump would be transportation. But
Well,
healthcare
hospitality
wins.
down there is pretty big one.
Yeah. But yeah. But when you look at overall hospitality, you could probably fit 4 of those in the healthcare.
Well, yeah, easy because like I get, you get back to the lowest ones, and the cost of public sector is $2.6 million in 2023.
Yeah.
It was 2.07 in 2022. So, there's a substantial drop in retail, which is great. But overall, you're looking at healthcare is the one that's out of control.
Yeah. For 13 years.
Mm-hmm.
So what we're doing is not working.
No, it's not.
And, this is the point Donna and I talked about before we started recording, which is even the things that we can do and we have tried to do in the healthcare sector, it's not sticking. And so as much as we would love to say, let's push on to the next advancement, we hadn't got the basics right yet.
Yeah. Well, when they're not even doing the things, the basic hygiene. We use the term cyber hygiene and trying to, kind of get people to see it's the same as washing your hands and that kind of stuff. And if you really did compare the two, you could see just because we know cyber hygiene would prevent a lot of this, really good cyber hygiene.
Mm-hmm.
And based on the numbers, healthcare is absolutely filthy.
We can't even get you to wash your hands right.
I know, right? Yeah, but I know that the next stat we pulled, and we just pull these stats and study them and discuss them. So the next one is the one that got David's attention, where he just said it like 2 or 3 times over and over.
Yeah. So only 1 in 3 data breaches are caught by the company's own tools or own people. Only 1 in 3. So the rest of them are, found by other folks, other third parties,
or they
whatever.
get the notice from the attacker.
Yeah. Yeah. So yeah, part of me scratches my head like, what? How can you not know? I do wonder though, how many may have been caught by the company's tools, but not by the people that were supposed to be looking at the tools.
There is that. I know of cases where that happened. So yeah.
Yeah, nothing's worse than you're like, oh, we just discovered a data breach, and you start looking, and it's like, yeah, but this report over here has been telling you for the past 6 months that this thing has been going on.
Yeah, and that goes perfect segue into the amount of time it takes to identify a breach.
Yeah, not
2022, 207 days.
Yeah.
Get all excited in 2023. That dropped to 204. Plummeted, David.
Wow.
Plummeted.
Is that because of leap year?
On the other hand, the flip side of that, where it took 73 days to contain the breach in 2023. So we saved 3 days on the front and just moved them to the back end. Because it was 70, now it's 73. It went from 207 to 204. So just moved to 3 days.
Yeah, so we're finding them faster, but yet we're taking longer to contain them.
Because we actually see what happened.
Yeah.
We'll go with that.
Yeah.
Yes.
Oh,
but, ouch.
So the next one, and for all you folks you're too small to have a data breach.
It's not
Just
going to cost me that much.
It's laughable to even say you're in trouble, because according to this report, and it broke out employees into several different sectors, not sectors, but number of
Groups.
employees,
Yeah.
groups. There you go. So fewer than 500 employees, then 500 to 1,000, 1,000 to 5,000, and so on. But for those of you with 5,000 employees or less, it's going to cost you dearly, because the cost of the data breach went up in all those areas. Fewer than 500 employees went up. 500 to 1,000 went up. 1,000 to 500 went up considerably. It wasn't until you have over 5,000 employees that we actually saw a decrease in the cost of a data breach count or by head count. So the cost by how many employees you have.
Yep. There was a substantial drop in the 500 to 10,000 and still a drop in over, 10,000 and then over the 25,000. All of them dropped.
Yeah. So if you happen to have 4,999 employees, I would hire a couple more so that your breach cost would go down.
Because that's all it took. That's it.
All.
That's
Just
all it
hire a
took.
couple more. It puts you in the other category and you're good.
Well, if you look at fewer than 500, right? And this is where it's always a tricky one because, there's no way it could cost that much. Okay. Fewer than 500, and this is worldwide numbers. We're not looking just at healthcare. This is worldwide numbers. Fewer than 500, the price we're above 3 million. So that 4-point-something million, you're about $1 million shy of that if you're under 500. So 3.31. 500 to 1,000 is up to 3.29. And boy, 1,000 to 5,000, 4.87. They're above that average.
Yeah.
So,
Wow.
ouch.
Mm-hmm.
Yeah, those are substantial increases, whereas all the others dropped. So anything of, well, I'm too small, you're a bigger target if you're small. You just don't seem to understand that. You're less likely to be able to prevent the attack, and they know it. You're also a potential opening into other environments, and they know it. So really, up to 5,000 is what they're making their money at. The bad guys, anyway.
Yeah. This next section here is one I really like to see every time it comes out, which is the cost and frequency of a data breach by the initial attack vector. So how is it actually getting started? Because this is where I want to know, where do I need to put my money? Where do I need to focus? If I'm, using my 80-20 rule and I can't protect myself from everything, what are the few things I need to really look at? And for me, I want to look at, what is the likelihood, how frequent it might happen. Then also, what's the impact? Because it might be different. So it could be something that's not likely to happen, but it has a big impact. And that's what this chart kind of shows us here. And it's, if you think phishing is still a big problem, you'd be right. As we've talked about recently. So
it's
phishing
in that
is still
top right corner.
Yeah,
Boom.
it's still number one. 16% of the time it's going to happen by phishing alone. And then, not to be too far behind that, is stolen or compromised credentials is your other one. So and that the funny thing is that probably comes through phishing.
Yeah.
A lot of times.
And they put social engineering at 8%, but it's often used to get the phishing to work and those kind of things. But the amount of social engineering, stolen or compromised credentials, phishing, and business email compromise, which again is generally through phishing and social engineering, all of those run at 4.5 million or more of damage.
Yep. The highest one on the list is malicious insider, but it's also one of the lowest.
Yeah.
As far as
Awful.
frequency is one of the lowest, cost is one of the highest. So,
Yeah.
when you start looking at it, I look at it like, okay, let's look at the middle or the top 5. So you're looking at phishing, stolen or compromised credentials, vulnerability, so unknown 0-day vulnerabilities, cloud misconfiguration, and business email compromise. Those are your top 5.
As far as statistical likelihood of occurring.
Right.
But
Not by
then,
cost.
yeah, the ones that are going to cost you the most when they do happen is malicious insider, business email compromise, stolen credentials, and phishing. 1, 2, 3.
Yep.
What
And
would be the
social
other one?
engineering.
Social engineering.
Yep.
So you've got a lot of repetitive things happening there.
Yeah, because you could say that phishing and business email compromise and to some degree stolen and compromised credentials and social engineering are all email problems. So if you just have good email security, you could knock out half the list.
One would hope. Hope.
Yeah, potentially. But so tell us how we can save money with our response plan, Donna.
Well, they did look at your ability to respond, meaning the length of what they call the life cycle of the data breach. Like from the hair on fire is boom, but the data breach life cycle begins when the intrusion is left of boom. And then right of boom is the containment and, mitigation, the notifications, all of those kind of things. So if you can limit the time from intrusion to the end, left and right of boom, no more than 200 days. Keep it under 200 days, you save just like $1 million right off the top.
Wow.
I mean, that's from 4.95 to 3.93. If you go over 200, you're just costing yourself more and more money. So you want that incident response plan to say, we got to catch it and stop it and do any notifications and have it all handled within 200 days.
And Donna, I know
That's what our clock is.
There are people that are listening right now that thought that they could probably get this done within 20 days.
Oh, I know. I always feel bad for people that are just dealing with it the first time. And I'm like, we'll be dealing with this now for a couple of months. And they're like, really?
Yeah.
Yeah. If you're lucky, we'll get it done and be out of here in 3 months. Really? Yes. Now, we don't know what's happened those 30 days that there was an intrusion, which could extend, but that's the whole thing of from the time of boom, left of boom, everything that occurred leading up to the boom, everything occurred after that until you're done. If you keep that under 200, there's a substantial difference. But you know how you keep it under 200, David?
How do you do that, Donna?
Having a plan and testing it.
Yeah.
So another thing they looked at that new this year was asking how organizations prioritize risk and vulnerabilities, and that versus how did that impact the cost of the data breach. And again, we learned something that if you are proactive and risk-based vulnerability management, meaning you're out there testing and monitoring for it and penetration testing and all of those kind of things and saying, where is that high likelihood that this is going to occur? What is my risk that this is going to cause me problems? That you have a lower average breach cost to the ones who just look at, well, if this common vulnerability scoring system, the CVSS, is rated at this or higher, we'll deal with it, but otherwise we won't. They're not proactively evaluating them based simply on score, which, I know some of the systems actually work that way, some of the automation systems, right?
Yeah. Yeah, but this is why we always say we're not looking at things from a compliance perspective.
Mm-mm.
Because you can be compliant and still have terrible security.
Mm-hmm.
And, you still have a lot of vulnerabilities and still have risks that you're accepting and all those things because you're looking at things just from, I got HIPAA covered. That's not great,
No.
especially whenever you realize that HIPAA is the bottom. It's the lowest you should possibly do. So when you tell me I got HIPAA covered, that's like, I got the floor covered.
Yeah.
That's great.
There's no holes in the floor.
Yeah.
But they may be weak and creak.
Yeah. The walls are about to fall in, but the floor is solid.
So that risk-based analysis that we talk about all the time, this is business risk management, like any other risk that a business faces. Just like you were saying, here's all the things that could go wrong. Now, how do I prevent that from happening? Which ones am I going to worry about? Well, if you do, you go from that 4.5 to 3.98 million.
Yeah.
Just by saying we are a robust risk-based analysis is how we manage threats.
Mm-hmm.
Robust. Not just we use risk-based. And then when I say, what method do you use for your risk analysis?
That's
and people scream that it's proprietary. And I'm like, okay, right away, I'm not feeling comfortable with your understanding of the concepts.
Yeah. I didn't know that risk-based analysis was a proprietary thing.
It's just what are you asking me for? Blah, blah, blah. Just what method you used. There are several approaches.
You should put a question in your questionnaire that says, "What is your secret sauce?"
JK. Just seeing if I can get a stir. But I'm happy to know that the data continues to show that what we teach and the way that we approach these things is still, we're on the right track.
Mm-hmm.
And they did publish and say, okay, here is the ways that you can best save money. What is the best advice based on these findings? And it's along the same lines, but they had a cool little graphic. 1, build security into every stage of software development and deployment and test regularly.
Yeah, I would add to that to build security in every stage of any kind of deployment and test regularly.
Yes, software deployment, hardware deployment, any of that stuff.
Yeah, new services, new vendors, new whatever.
It's got to be built in there.
Yeah.
That's called, wait a minute, having a culture of privacy and security.
Oh.
Or privacy and security by design, where it's always discussed. And then, number 2, modernize data protection across the hybrid cloud. Mm-hmm. And the hybrid cloud means we got some stuff locally, we got some stuff in a private data cloud, and then we have the public cloud. It goes across it all. Data is everywhere. And if you think it's only in your EHR, you have to be a micro company who is very, very careful to make sure that that is the case.
Yeah. Typically, it's David, we had a data breach, I believe, but all of our data is in our EHR. And then usually by the end of the day, it's no, data was in email and it was in Microsoft 365 and it's in Google Drive and it's in Dropbox and it's at their home and it's written down here. It's
on the laptop. It's on the,
it's on these USB sticks. It's just, we didn't realize it was everywhere.
Uh-huh.
I know. So now let me put my cowboy hat on and let's wrangle some data together.
Yeehaw! So number 3, use security AI and automation to increase speed and accuracy.
Yep.
Now, we did talk about not having complexity.
Mm-hmm.
We're not saying make it more complex. We're saying use the right tools and pay attention and automate what you can.
Yep.
Because keeping that 200 days, under 200 days, remember.
And just remember, the bad guys are using AI and automation to increase speed and accuracy as well.
Which is why we have to do it.
Exactly.
Yeah. It's kind of like they're now using a Formula race car against us, and we're still out here cranking the front of the Ford.
Got my Pinto ready.
Oh, good Lord. Pinto. That's like a GMC Pacer.
Yeah.
Remember those?
Uh-huh.
Those look like the little kid bubble machines. And then the 4th thing, strengthen resiliency by knowing your attack surface and practicing incident response. Okay, knowing that gets back to doing a proper risk analysis. Step number 1, understand your attack surface. That's what it is. When we say, what hardware, software do you use, and what are your critical applications? That's what we're trying to figure out. What's your attack surface?
Yep. But if you're still saying, I don't have anything anybody would want, you're way behind.
Yeah. That's no. I mean, everybody's got something now. I want your computer. At a minimum, they want your computer so they can take any data they find and scrape it out of there and use it for whatever, to use it to phish somebody or social engineer somebody or those kind of things. And then they're going to use your computer to attack somebody else.
Yeah.
If you're not paying attention.
I was going to say that at a minimum, they just want the processing power of your system to use as a bot, something.
Yep.
So yeah, you've got something.
Yeah. If you have a connected device, if it can connect, it can infect. That's my new Johnny Cochran thing. If it can connect, it can infect. Trademark, Donna Grindle.
First mention this date, 7/31/23. Actually, you mentioned it before now, so.
Yeah. There we go. We got it. So basically, it's the same stuff. Don't get overcomplicated. Have an IR team that has a plan that they have tested and respond quickly.
Yeah.
If it looks weird, go ahead and deal with it now.
Yeah. And I would convey that to your team, please, your employees. Yeah. I cannot tell you how many times I've been brought in on something and it'll be, well, this happened a week ago, but so-and-so just told us this morning.
Yeah.
Well,
we all need to freak out together.
Yeah. It's crazy excuses. Somebody was on vacation or they were out sick, or I just didn't want to bring it up on so-and-so's birthday or whatever. But it just blows my mind that things happen and somebody will just say, well, I know this happened a week or two ago, but we're just now finding out about it. Not good.
Yeah.
All right,
That's
folks.
That's always the hard one for me.
Yeah. All right, folks, that is our show for today. Thanks for listening. Remember to follow us and share us on your favorite social media site, and be sure to give us a rating and review. We appreciate it. And remember, for Donna and myself, the HIPAA is not about compliance. It's about patient care.
You've been listening to the Help Me with HIPAA podcast, hosted by Donna Grindle and David Sims. The show created to help you with HIPAA. For more information or to ask us a question, visit our website at helpmewithhipaa.com. Neither Donna Grindle or David Sims are attorneys, and they do not offer binding legal advice concerning regulatory compliance. The information in this podcast should not be relied upon or construed as legal advice in any way. Consult your attorney for legal advice concerning compliance with HIPAA regulations.